BoomerLifeDrZokolSept6th2014Seg4.
Whenever I see your smiling face, I have to smile myself because I love you. Yes, I do.
Yes, I do. There's James Taylor, whenever I see your smiling face. Welcome back to Boomer Life. I'm Tom Lucas. In studio with me today, a couple of great buddies, good friends, Dr. Bobby Birdie and Dr. Ron Zokol. Welcome, guys.
How you doing?
Nice to see you again.
You too.
Guy was singing there about your smiling faces, and you were both smiling away.
We have a good time here.
You do, and we have a good time, too, when people go to visit you at BC Perio Dental Health and Implant Center. It's a brand new office in Vancouver on Broadway.
That's right.
Great coffee. I keep talking about that, but that's one of the reasons why I go. Like, you know me, I just pop in just to say hi and have a cup of coffee.
Yeah, that's what everyone tells me.
But listen, let's say that I've got a regular dentist, which I do, and he suggests I go and see you. So does that mean I give up going to see my regular dentist and I just stick with you guys? How does that work?
No. Heaven's sakes, no. No, we don't want to disturb the relationship you have with your existing dentist. What we want to do is help you and your dentist provide you with a advanced level of service if you need it.
Well, sometimes my dentist and I don't get along that well, so maybe it would be a good idea if he did pawn me off on you guys.
No, there's a lot of people out there who may be between dentists and don't know where to go, and we're helping everybody. Our goal is if you come into our office and you have a consultation with Bobby or I or another dentist in the group there, and we see some issues that require a general dentist to take care of them, and if you don't have one, we'll find one for you.
Okay.
And if you do have one, we'll work in harmony with your dentist to make sure that we continue in that quality relationship that you have.
Now, Ron, you just mentioned again the word consultation. How much is a consultation?
Absolutely zero.
Free.
It's free.
Free.
That's right.
And they say you can't get anything for free anymore, right? Well, they certainly can.
It's for free, I'm telling you.
Free coffee, free consultation.
Mm-hmm.
And so somebody comes to see you for the first time. They sit in the chair there. They can watch TV, too, because it's right up there on the weird place for TV is on the ceiling, but that's okay.
Yeah, it's for dentistry. It's great, right? You're laying
I'll
back.
bet, yeah.
Yeah, great.
But it's for the patient, guys, not for the dentist.
That's right.
so they come to see you, and they sit in the chair. You have a little chat. And what do you chat about? What do you look for?
You know what? In honesty, you come in, and it's a free consultation, and we do a very thorough examination. We look all inside your mouth. We take a look at all the teeth, take a look at everything else in anatomy-wise, and sometimes, if it's warranted, we get a CT scan, and a lot of times that's complimentary, and it allows us to gather the most amount of information so we can provide you with the most informed kind of treatment plan that we can find for you.
I'm glad you mentioned the CT scan, too, because people these days are a little nervous of radiation.
Yep.
And this CT scan machine has less radiation than your average X-ray?
Yeah, so it's actually less radiation than a single dental X-ray. It's
Wow.
the least radiation right now in the entire world. It's pretty amazing.
That's pretty cool.
Yeah, it's in Vancouver. It's not like in New York City or something. It's right here.
And so if I go to see one of the other doctors there, okay,
Mm-hmm.
are they going to do the same thing for me?
Absolutely. They're going to provide you with a free consultation, and they're going to provide you with everything else exactly the same.
And once we finish, you can the computer spits out all the information that you've put in there, and you can tell me exactly what I need to have done, how long it's going to take, what it's going to cost.
Absolutely. You get a step-by-step plan of what it's going to cost, how many steps you need. Sometimes if things are really advanced, we might have you back for a second consultation, but in general, you'll get your information on that one visit.
So you learn a lot of stuff from people when they come in to see you.
Oh, everybody is a little different too, which
bet.
makes it interesting.
I'll bet. And again, you need to be at least maybe 21-ish. Your face has to stop growing.
Absolutely.
That's as young as you can be.
Well, that's for an implant.
For an
that being
implant.
said, we see a lot of people for other things, whether it be tissue grafts or stuff. For instance, one of the things we do that's really fun is we really help with accelerated orthodontics. So if someone is getting braces and they're, maybe an adult that is getting braces, we can provide services to help speed that up, which is pretty fun.
So you do more services than just putting implants in people's teeth.
Absolutely. We're a full scope office.
Yeah. So
Yeah.
what sort of things do you handle? You mentioned a couple, but a few more.
So we still do implants and things that are related to implants. We treat periodontal disease,
Right.
Treat recession, and do tissue grafting as well. And then from a prosthetic standpoint, provide major services, whether it be comprehensive reevaluation, doing a lot of full mouth reconstruction on crown and bridge, and which can include implants at times as well, and provide dentures and implant bridges as well, and things on teeth as well.
All right. And again, let me ask you for a couple of tips you can pass along to prospective patients out there, people that are listening to the show today, and they're thinking, maybe I could take better care of my teeth. What could they do?
I think some of the best things they can do is make sure that they're brushing and flossing every day.
Mhm.
Okay, make sure they're trying to at least brush twice a day and floss. And the best time to do it is at nighttime. The reason why is all the damage that's done, whether it be from cavities, from periodontal disease, from everything else, it happens at night. It happens at night because at nighttime your mouth is really dry. You're not talking, you're not eating, you're not drinking. So it's the time where everything can get at all of your anatomy and all the tissues and bone and the teeth. So brushing and flossing at nighttime is the most important time to do it.
Or you're sleeping with your mouth open.
Yeah.
Absolutely.
Let me add one other thing.
Yes.
All the studies have shown that people who attend a dentist regularly for a cleaning and a checkup spend a lot less money on their dental health and have better dental health over many, many, many years than if they stay away from the dentist. So one of the most important things you can do is find your disease problems early and get it taken care of, and you end up spending far, far less money on it and have better dental health long term.
No, I was thinking of you guys the other day. I was in one of the department stores and I bought myself a new toothbrush.
Good.
And I finally bought one of those ones, it's a round one with a little battery that makes it go. And I thought, hey, the dentists have round toothbrushes. Maybe I should have one too.
Yeah, I hear you.
So I play with it in the morning. It's 4 o'clock in the morning when I come in and do the morning show. So is that a better kind of toothbrush than having the old-fashioned toothbrush?
Well, an electric toothbrush is always shown to clean better. It's going to remove more plaque and more calculus and all that kind of stuff. The best thing that I always recommend electric toothbrushes to my patients all the time, but the best things are this. Number one, it has a timer on it most times, so you're supposed to brush for 2 minutes. Now, 2 minutes is about one song on the radio, so we want to make sure they get that done. And then number two is if you push too hard, it stops. And then you can't get into automatic mode, which everyone does, where the ghosts are going everywhere, where they just start brushing. With electric toothbrush, you have to guide things. So because of that, it prevents a lot of the damaging brushing that people do, which causes recession and bone loss. So electric toothbrushes are great.
You mentioned 2 minutes. That's an old Beatles song. They did wonderful things in 2 minutes, and you can do wonderful things to your teeth, too, in a couple of minutes, right?
Absolutely.
All right. So people want to come down and see you. Again, the consultation is free.
Absolutely.
And can they make an appointment through their dentist? Do you do referrals? Is the word I'm looking for?
You don't need a referral to come to the office. You can call the office directly or go on the website. You can book a consultation online even. But you can also be referred by a dentist. We work with a tremendous number of dentists that refer patients over to get services, and we work together and collaborate together. So there's a lot of avenues to come see us.
Yeah, and you can ask your dentist. What do you think? Would it be appropriate to refer us to BC Perio? Refer me to BC Perio and see what they have to say. And often the dentist will say, sure, that's a great idea.
Well, I know that if you're not feeling well and you got to go and see the heart doctor, it could take you, 6 months to get in. How long is it going to take to come and see you guys?
You know what? Right now, what we try to do is we try to keep slots open every week for people that need to come in for an emergent basis and also for these kinds of consultations. The other thing too is that we have 5 doctors in the office right now. So because of that, you're able to see somebody if you need to, and that's something we're going to always try to strive to kind of maintain, is so that people can get in when they need, because if something's an emergent situation, we want to make sure we can take care of you.
How can I put this? You two gentlemen, Dr. Birdie and Dr. Zokol, are the mouthpiece of BC Perio, right? Let's face it, you're the rock stars. But the other dentists there are typically they're well qualified.
Oh, they're amazingly
totally
qualified.
Do a great job.
Absolutely. Yeah, the 3 specialists that are in the office right now, they're great. They do so much work. They've got such a long-standing, good reputation. They've done great things in the dental field, in the community, in the Lower Mainland for the last 30, 40 years. It's amazing.
They're knowledgeable and they're caring.
Absolutely.
Fantastic. And we're going to try to get some of those people to come onto the show next time you're with us.
We're going to try. Absolutely.
All right. Now, before we go, let's get the addresses of the 2 locations.
Okay, so the Vancouver office is 777 West Broadway. It's suite number 501. And then the Coquitlam office is 1175 Johnson Street, and that's right next to the Coquitlam Center. And it's suite 250. We're right storefront. It's kind of nice to have a specialist office where we're all there providing full services, but we're right storefront. It's pretty nice.
All right, now the telephone number in Vancouver
is 604 872-0222.
In Coquitlam?
It's 604-936-8244.
And what did the dentist see when he went to the North Pole? A molar bear. Next time we'll try not to have some jokes.
All right.
PCPerio.ca is the website, right, guys?
That's right.
It is.
Fantastic. Thank you for being with us again today.
Thank you, Tom.
I love talking to you guys.
Thanks so much, Tom.
And I'm coming by for a coffee real soon.
Yeah, come by.
Okay, we'll see you real soon on Boomer Life. It's Tom Lucas with Dr. Ron Zokol and Dr. Bobby Birdie, and we thank you for listening, and y'all keep smiling.